WHO is continuing to explore every avenue for increasing access to vaccines globally. This afternoon, WHO gave emergency use listing to Sinopharm Beijing's COVID-19 vaccine, making it the 6th vaccine to receive WHO validation for safety, efficacy, and quality. This expands the list of vaccines that COVAX can buy and gives countries confidence to expedite their own regulatory approval and to import and administer a vaccine. The Strategic Advisory Group of Experts on Immunization, or SAGE, has also reviewed the available data and recommends the vaccine for adults 18 years and older with a 2-dose schedule. Wednesday's announcement by the United States of America will support a temporary waiver of intellectual property protections for COVID-19 vaccines is a significant statement of solidarity and support for vaccine equity. I know that this is not a politically easy thing to do, so I very much appreciate the leadership of the United States, and we urge other countries to follow their example. I also want to emphasize that WHO values the incredible contribution of the private sector to the pandemic and to health in general. We would not have the vaccines, medicines, diagnostics, and devices that save lives and improve well-being around the world if it were not for the innovation of the private sector. WHO supports companies making a fair return on their investment in research and development for investment in further innovation. We are in an unprecedented crisis that requires unprecedented action. Cases are at a record high. Almost 100,000 people are dying globally each week. And we have a chronic vaccine crisis. The World Trade Organization provisions for IP waivers were designed precisely for a situation like this. If we don't use them now, then when? It's also important to remember that intellectual property waivers will need to be accompanied by transfer of technology and know-how for this difficult-to-make vaccines. We continue to encourage all member states to support technology transfers through CTAP, the COVID-19 Technology Access Pool.